Hi, I'm Laura Fielding. I'm the Executive Director of Red Berets Medicare for All. How are you all doing this afternoon? I just got home from work and I have a call to action for everybody. Hopefully, all of you that are watching, or if you are watching and you haven't heard anything about this, tomorrow, Saturday the 27th at 1:30 Pacific and 4:30 Eastern, you can join us for a live a live online showing of the documentary Power to Heal. And that is our special guest panelists, Dr. Victoria Dooley and LA Chargers running back Justin Jackson. And then it will be myself, and it will be Andre Stackhouse, who is emceeing or hosting facilitating the panel discussion, and then Whole Washington campaign director Sean Kavanaugh. So that's our panel tomorrow, and I'm super excited about it. And what I wanted to do is give everybody a call to action and let everybody know how you can help. So please share this video. Share it in Twitter. Make sure you write something like call to action. Okay, so when you share the video, write something that's like, here's how you can help. And then just write, okay, I can say this. I can explain it. I knew I would be able to explain it better on a video but I did a lot of massages today, and I could really feel my excitement and my anxiety. I was trying to normally, I'm pretty calm or pretty zen during massages, but I felt like I was transferring my really hyped up energy for tomorrow onto the clients that I was seeing today. And on that note, I was able to share and invite 6 or 7 different people from my work when it's felt appropriate. A couple people that I actually work with, and then a nice little handful of patients who were super excited to find out that something like this is happening in Washington State. Hello, we have a major health. Everybody is understands that our healthcare system is broken. People can't afford to go see the doctor. They can't afford their copays, their deductibles. They understand that. And so they're really excited to come join us for this discussion and seeing this film. The film, Power to Heal, is a documentary narrated by Danny Glover, and it is the story of life in America for Black people and people of color before the hospitals were desegregated, and the atrocities that were visited upon those populations of people, and how they came together to desegregate the hospitals. And that was an integral piece in passing Medicare. We wouldn't have passed the Medicare system. And as much as we need it to have more funding and we need to improve and expand it, our government likes to pay for for endless wars, but it doesn't like to make sure that our social programs are fully funded with the tax dollars that we pay. So anytime you hear somebody say, well, why would we want Medicare for all? The Medicare is not that great. First of all, there's some people that have nothing. And secondly, we are, with National Improved Medicare for All, of course, that's why a lot of times I will in Twitter bother to get out, we need National Improved Medicare for All. Sometimes I just say Medicare for All. But honestly, to really let people know that we're talking about improving and expanding it and then giving it to everybody, not just people over the age of 65. Anyway, here is that call to action. We're really, really excited to show that film tomorrow. The film is about 60 minutes. What we're going to do is start at 1:30 with the panel discussion. We're going to kind of do, short and sharp, getting some of the sharing from our panelists, especially our really special guests, Dr. Victoria Dooley and Justin Jackson. So they'll get the time that they need and that they want to spend, but we want to move kind of quickly into the film, because that's what everybody's there to see, and that's how we're going to change things, is to make sure that everybody understands that change is possible, and we have to come together to finish what was always meant to, where we were supposed to go with this. So the call to action is, please share this video, and I'll get into the second Ryan Knight clip and Amped Up Pod that's dropping and how we can use that in a second. Basically, when the event starts, Whole Washington is going to be live tweeting the event. Like they're gonna drop tweets regularly. So please put your eyes on @Whole Washington. Go and follow them right now and see what they're doing, but typically they don't put out, they do a good job with the social media, but it's like a couple of tweets a day or something like that. But they're going to really kind of be like live tweeting, and they're going to not just be putting out their own tweets, but looking for people that are using the hashtag Power to Heal, hashtag Black History Month. So we want Power to Heal, Black History Month, and we want you to @Whole Washington. So you can say, @Whole Washington, this is what my healthcare story is. This is why I fight for Medicare for all. Whatever it is that you want to put into a tweet, and you can even make a thread out of it if your story is longer than one tweet. Or you have written a healthcare thread that's got a lot of stuff on it. You can retweet. I'm just giving you ideas here. You can retweet that valuable thread that you want to be shared out there by retweeting it with, here's my story. Here's my healthcare story @Whole Washington, hashtag Power to Heal, hashtag Black History Month. Okay. And then Whole Washington and a couple of the social media team's going to also be looking for these tweets and helping to make sure that Whole Washington's kind of seeing them all. They're going to be everybody's going to be amplifying them, so that Whole Washington will be able to retweet some of them. And hopefully with this, if we can get a lot of participation and people to find out about this idea, we can trend Power to Heal and Black History Month, and we can really get Whole Washington's out there. Everybody should be following Whole Washington. They do amazing. Because I'm a board member of Whole Washington. We've been talking and this leads me to the Amped Up podcast with Ryan Knight. So there was one clip that's been dropped, and then his producer Rob has he's an activist. He's a local activist. He's been very, very busy with CalCare and with his local DSA chapter. So he's been super busy. He didn't cut another clip of my interview, but he's been in communication saying, I have cut another clip of the interview. I wasn't expecting that or anything. I was hopeful maybe they would do a second one. So I'm super, super appreciative of that. When that drops, and it could have dropped already, but keep checking in with @AmpedUpPod and @Ryan, @Proud Socialist, and watch my feed. And so when you see the clip, you can retweet that with whatever you want to say, customize it, personalize it. If you want to write something that is to do with the clip, what your thoughts are on it, that's fine. Or if you want to say, I can't wait for tomorrow's live showing to see Dr. Dooley, and at them. Let's get all this going. I mean, maybe it's going to drive Justin Jackson and Dr. Dooley bonkers, but I just think let's let everybody know that Dr. Dooley and Justin Jackson are fighting for the 99%. Dr. Dooley is a national organizer, was a Bernie surrogate, a surrogate for Bernie Sanders 220. She is very highly focused on making sure that we all get it at the federal level. And I think all of you that have been following the work that I've done with the Red Berets, There's no question about it. Like, we absolutely need this. Representative Jayapal is going to be introducing her bill that's going to have a different bill number than 1384. That's going to happen sometime in the very near future. We're always looking to what can be possible. And if we get enough energy going for this, the point is that a local organization like Whole Washington is putting on an event that we're hoping has got some national influence. Let's get everybody seeing Power to Heal, because it's an incredibly powerful documentary. It's powerful because of the atrocities that occurred in this country. And then what would have happened if the civil rights leaders and movement people and all of their allies that cared enough to say, we're not going to stand for this anymore. This is not the country this is not the country we want to live in or call our own. We are going to stop this. We absolutely have to get this message out there, because that's how we change minds and hearts when people are feeling so deflated and so stuck. Like, we have veto Joe Biden. The corporations are just too strong. We're never going to overtake this. Whatever if we can trend this and get everybody seeing this very, very important film, and absolutely linking the fact that we need Medicare for all with Black Lives Matter, with Black History Month. And Dr. Dooley will speak to this on the panel tomorrow. I'm hoping she's going to speak on whatever aspect, as a family physician and Medicare for All organizer, that she wants to speak on, that she feels is the most what she wants to speak on, right? But she has, paying attention to her interviews lately and her Twitter feed, she really does shine a spotlight on the inequities that COVID-19 the deeply racist system that we have has only been not exacerbated, but definitely people of color and in marginalized communities are dying at higher rates, are being much more devastatingly affected than their white counterparts. So she'll be drawing. So that's why it's like, I haven't seen anything really. I do stay sort of in my own, circles of healthcare justice, but I haven't seen anything other than lip service coming from the Biden administration on Black History Month. You don't just get to make a tweet that has like a civil rights leader icon and say, remembering the blah, 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 Black History Month, and then be the veto president who's not going to save lives. It's like Ryan Knight said, don't just say Black Lives Matter, fight for Black lives. So yeah, that is what we're here to do. We are here to challenge and push the capitalists and the neoliberals to say, you don't get to say that. You don't get to just make a convenient, nice sounding, placating tweet about stuff when you haven't done anything meaningful in this whole entire month. And if I'm wrong, go to my Twitter feed and show me something that's like really deeply valuable, that's actually putting that into action to actually change lives, pass policy that's going to make lives better. Because if anything's happened, I've missed it. That's sarcasm. I haven't missed anything. They haven't done anything. So it's our opportunity tomorrow to force them, and we have to continue to call them out and embarrass them and push. But more importantly than that, because we'll continue to push, but I don't know how you can push a corporatist to not do what it was they were elected, what they were funded to do, funded by the big donor class to do. And that's to get in and make sure that nothing will fundamentally change, right? So focusing on what we can do, sharing with the client and stuff today about what's possible. And there's this, and she was so excited about it. She's never seen the film. She didn't know anything about how would she know about Whole Washington? We can't even get a progressive, independent or a sort of progressive-y outlet like The Stranger from Seattle to write about whole Washington. And that has its own story, and that's not by accident. And I urge everybody to continue to ask Brianna Joy Gray to invite Georgia Davenport, field director of Whole Washington, onto Bad Faith Pod, because it's time to start talking about who's actually hampering down the single payer movement, the Medicare for all movement, the universal health care movement, both at state level type stuff that we've seen here in Washington state, and more broadly, like what are supposed single payer Medicare for all allies, are they helping or are they actually hindering? Because they have this very clear idea of how it needs to get done, and they don't want to hear from the grassroots. For example, force the vote. That wasn't the time. Maybe they plan to try to force the vote now when the bills dropped. Maybe they've got that whole plan. Well, you don't have anything to actually bargain with. You can ask the grassroots to come out and put a lot of pressure, which some of us are very dedicated, and we're going to do that. But you can't hold the speakership over Nancy's head. And I don't understand why a politician who co-signs 68,000 deaths per year, that's what she is. She's a co-sponsor of 68,000 deaths per year. Nancy Pelosi, because she refuses to co-sponsor Medicare for all. It's her job as leader of the House to co-sponsor that legislation that the overwhelming majority of Democrats want, and that a lot of independents want, and even the majority of Republicans want. But she's there to represent the Democrats. The Democrats overwhelmingly want this policy. They're just told we can't do it. So there's some people that are just like, well, and then maybe eventually, and maybe a public option. And here in the case of Washington state, maybe let's study it for 4 more years. Let's introduce 5399 when there's a perfectly good bill that has 7 co-sponsors that's ready to go, that's approved by the Department of Revenue. That would save the state of Washington $9 billion every single year and cover all healthcare, including hearing, dental, auditory, mental health, reproductive care, holistic therapies like chiropractic, massage, acupuncture. I am getting fired up. So we really need for people to start understanding that this thing about having only one strategy and not listening to the grassroots and not supporting that, it's fine to be like, I have my bill, I'm a federal legislator, this is how I think we need to do it. Nevertheless, they need us. They need the grassroots to make these phone calls. And of course we want to do it because we support their legislation. But at the same time, how good does it feel to donate so many hours, thousands and thousands of hours? Some of us, many of us, over several years, over more years. Me personally, 3.5 years of, just tens of thousands of hours, for really being honest about it. And then to not even be able to get an endorsement for, I'm focused on my federal legislation. And thank you so much, Whole Washington, for your local efforts. As a Washingtonian and healthcare justice champion, I thank you for everything that you're doing. I endorse your work here locally. And I hope that you I hope you continue to work with us to make sure that we can pass this federally. So when I drop my bill, I'm going to look to Whole Washington to please pick up the calls to action. She doesn't need to tell us that, we do it, but we're there for her to call on, to say, please send out to all of your volunteer base. This is what the calls to action I'm asking. So we are at her fingertips, ready to help, ready to mobilize. But it would be very nice if she said, I endorse Whole Washington. The work that you're doing is absolutely building the kind of coalition, the kind of grassroots energy, the creative ideas, going and telling people at your work. You know what? I could just kind of close that down and be like, I don't know if I'll take that risk. This person is coming to see me. This is my financial, bread and butter. I don't know how they feel about healthcare reform. I just think I'm not even going to mention it because I don't, that makes me nervous. I'm not going to do that. I care about this cause, and I'm able to frame it in a way. And obviously, if I were to bring it up and somebody said, "Oh, I don't want to hear about that," boom, boundary set. That's fine. But that has not been my experience in any single one of these interactions. Every person that I've told is like, "Oh my gosh, that's happening. Like, that's a thing. We need that. How can I help?" Two of the people that I've told already are going to be donating to Whole Washington for Red Berets tomorrow during the event. One of the persons, she loves pink, so I said, I have one that a good friend of mine has knit that's a bunch of different this is actually really much more vivid than I think it looks right there. It's gorgeous. But I said, so that was just perfectly meant for you. It's like these berets find the perfect person. I said, but I do have a red one. So you're going to get a red one. But I said, just donate what is right for you. There's a suggested donation. If you want to order one, that's what the price is. But she's going to donate probably for one beret or whatever she wants to do. And I'm going to take her these two berets. And then there's another person who's going to buy berets. So that's how you can help. You can go retweet my pin tweet. If you're following me, you can go to my pin tweet, which has the link for how to order right there. Order red berets. Help us help Whole Washington. That's what it says, with the picture of Nina Turner and Dr. Dooley, and Bernie's partial letter to me. So that pin tweet is always available for retweet, and for people, if people want to know how they can help, you can get this link out there on a kind of recurring basis. Hey, did you know you can help Whole Washington by helping the creative grassroots of Red Berets? Help them. We're donating our handwork. It's available there for people to go and support us, because one of these, if we do the math, if it's $40 or something like that, each petition, when we go to run our ballot initiative, is $1. So we would look at, if you paid $40 for, a red beret, this one's really special. One like this would be more than that. When I get one like this up there, this is brioche. It takes like a lot of hours. But this one is going to be for Justin Jackson. If he wants to tell me his mailing address and how I can send it to him. But the point is that, like, if you paid $40 or whatever for a basic red beret, the reason that we're doing it like that is some of the crafters are working on really, really limited means. So we do want to reimburse them at least for the cost of the yarn, where there's no way we can, kind of give handwork. Handwork like this is like, you can't buy this. I mean, you can, but it would be way more than with if I use nice yarn, and some of them are made with beautiful yarn that's a little bit more cheap and cheerful, but even still, it's quite a few hours of knitting. So think of it this way: somebody who's talented at crafting has contributed, 2 to 3, maybe 4 hours, or a little bit more if it's a really complicated pattern. They've done anywhere from 2.5, 3 hours, or crochets maybe like 2 hours. They put somewhere between 2 and 5 hours into that beret. So what do you think that's? Hopefully you think that for the fact of reimbursing the crafter a little bit for the yarn, and making sure that Whole Washington gets the majority of it. So you're probably sponsoring 30 petitions. Each petition holds 20 signatures. When we run our ballot initiative, we're going to need 350,000 signatures. So do the math on this stuff. It's really, really easy. You can see how, if you have friends and family that you think, I think I want to get like my whole family a red beret, and we're going to take a family picture. I'm getting kind of cheesy here, whatever. Or I'm going to take these down because I know that this work friend and that work friend, they support this. So I'm going to just kind of spread this around. Or I'm a local DSA organizer, like with the case of, don't know what that is. I'm going to ignore that for a second, but I do need to get going. So, do you remember what the call to action is? So, my point is when you buy a red beret, you are not just buying something that is like, oh, let me kind of do this cosmetic thing. These are something to be very proud of. When you buy one of these, you are a sponsor of 30 petitions or more, right? And how I'm not good with just automatic math. What is 20 times? I don't want to admit how stupid I am on here. But look, like you're sponsoring a couple hundred signatures with that at least, right? 200 or 300 signatures. And so if you want to think about it in those terms, think about like, oh, hey, I actually want to order an organizer bundle of 5 or 10, or I want to buy one red beret because that's all I need. But then I'm going to actually do I'll do some additional donation because I want to actually sponsor 1,000 signatures. Okay, that's for example. So because we're going to be going out and doing all this work to gather the signatures, and I don't want you to think that you can't help or play a valuable role in what we're doing. It's incredibly helpful if we had everybody think about it in these terms of, I want to think about this crafter has lovingly knit all of these stitches for these red berets. I'm going to be proud to wear it out in public and be seen as Medicare for All solidarity when we're kind of over past COVID, or just in my local Zoom organizing, whatever organizations or, grassroots activism that you're part of. Town halls, you can wear these to your town hall with whatever kind of Medicare for All button or on there, so that they start to see us coming. Oh shit, there are the red berets. They're those ones that are saying we need Medicare for all, not Medicare for all who want it, not protect the ACA, not the public option, Medicare for all, national improved Medicare for all. So, all right. So I do need to get off of here, and I want to make sure that everybody is really clear about this social media call to action. So think in your head, do you remember? We've got 2 hashtags, and I want you to @WholeWashington. Just start doing it tonight. Start doing it tonight if you wouldn't mind. Sharing this video, explaining what I've said, from Laura Fielding, Red Berets. Tomorrow, everybody please @WholeWashington with your healthcare story, and then use the hashtags Power to Heal, Black History Month. Okay? Because that way Whole Washington can see everybody's tweets and everybody's stories, and it's connecting people up so that we grow Whole Washington's following. We are an organization that's doing a hell of a lot for this movement. It's an organization that isn't just kind of sitting around for the right time or a good president or a whatever. Like, we're working every single day. And as far as strategies go, there is proof that this strategy worked in Canada to the north. So anytime somebody says something like, no, we have to do this at the federal level. No, that's not how it was actually achieved in Canada. It happened because one province fought like hell to pass it, Saskatchewan, and then other provinces followed because it was so popular. And then they got their Medicare system. So, and we don't care what happens first. If we manage to build enough movement for this and get everybody back to demanding it, just because we have Biden in office doesn't mean that we stop demanding this. If we manage to keep telling people in our communities and grow the demand for this, and we can pressure and pass it at the federal level, Whole Washington's not going to be, oh, darn, we really wanted our state level effort to work. We've put so much. If we can pass Medicare for all tomorrow, Whole Washington's going to do every single thing to do it. Okay. So please get our little social media call to action. Whole Washington live tweeting tomorrow, and go to Amped Up and Ryan Knight and start retweeting that clip whenever it drops, and use those, try to figure out a way how to work in @Whole Washington and both of the hashtags Power to Heal and Black History Month, so that it starts to you start to show people this is what's happening. There's an event tomorrow and everybody's going to be a part of it. I got to go. Thanks for watching. Please share the video. Thanks.